As a travel healthcare professional, it's important to understand the difference between contracted time, extra time, and overtime if you want to negotiate the best possible compensation packages. Contracted time is the time that you are contracted to work. For example, the standard travel nursing contract is for 12 hours per shift, 36 hours per week, 13 weeks, and therefore 468 total hours. Extra time is any time that you work in addition to your contracted time. And overtime is any time that state law mandates employers to pay you an overtime rate. And with few exceptions, overtime laws require that you be paid 1.5 times your taxable hourly rate. Now, it's very important to understand the difference between extra time and overtime. Specifically, not all overtime is extra time, and not all extra time is overtime. Let's take a look at some very common examples. First, let's take a look at 2 examples of when overtime is not extra time. In example 1, the overtime law in the state of California requires employers to pay overtime after 8 hours in a day and after 40 regular hours in a week. Therefore, if you're contracted to work 3 12-hour shifts, then 4 hours per shift will be overtime but not extra time. These hours are just part of your contracted time. In example 2, the overtime law in Texas requires employers to pay time and a half after working 40 hours in a week. Therefore, if you're contracted to work 48 hours per week, then the last 8 hours you work will be overtime but not extra time. Now let's look at 2 common examples of when extra time is not overtime. First, if you're contracted to work 36 hours per week in Texas and you pick up a 4th shift, then the first 4 hours of that shift are extra time but not overtime. Remember, Texas requires overtime to be paid after 40 hours in a week. Second, if you're contracted to work 3 12-hour shifts per week in California and you pick up a 4th shift, then the first 8 hours of that shift are extra time but not overtime. Remember, California requires overtime to be paid after 8 hours in a day and after 40 regular hours in a week. So you would actually have to work 5 full shifts before all your hours would be considered overtime on the 6th shift. How does any of this relate to negotiating travel healthcare pay? You see, the pay package for every travel healthcare contract is based on 2 fundamental variables. The first is your contracted time. For example, the standard travel nursing contract is for 12 hours per shift, 36 hours per week, 13 weeks, and therefore 468 total hours. The second is the bill rate. The bill rate is the hourly rate that the agency is able to charge the hospital for an hour of your time. When you negotiate with the agency for your contracted pay rate, the agency uses the bill rate and the contracted time to determine how much they can pay for each component of your pay package. For example, they might make an offer that breaks down to $25 per hour for the base rate, $10 per hour for housing, $7 per hour for the meals and incidental expenditure stipend, $1.50 per hour for travel expenses, and $3 per hour for medical coverage, for a total blended rate of $46.50 per hour. But what happens when you work extra time? When you work extra time, the agency is able to bill the hospital the same rate or more for your time. Therefore, you should try to negotiate an extra time rate that is roughly the same as or more than your total blended rate. Why? Because once you've worked your contracted hours, the agency has paid for all of the static variables like housing, medical coverage, travel expenses, and the meals and incidental expenditure stipend. So your goal is to make sure that you're getting full value for your extra time. Now, you will find that some agencies adhere strictly to the overtime laws when paying extra time. These agencies will only pay you the base rate or time and a half of your base rate for the extra time that you work. This means they're keeping a much larger percentage of the bill rate and you're getting less. However, there are also many agencies that will negotiate a good extra time rate with you. But be careful if they call it an overtime rate. Remember, overtime and extra time are different, so you should request to make it crystal clear in the contract when this rate will kick in. Again, When negotiating your extra time rate, use your total blended rate as the guideline and attempt to get that much or more. Finally, remember you're not required to work extra time. However, travelers often work an extra hour or two here or there, or want to pick up an extra shift here or there. This time can add up fast. Ultimately, it's up to you to decide if the extra time rate is important to you. If you found this presentation helpful, then you'll love our free ebook on travel healthcare compensation negotiation. It's got over 60 pages of basics, methods, and tips on how to negotiate the best deals every time. Visit blog.bluepipes.com/negotiate to get your free copy. You can also join Blue Pipes for free to get access to powerful tools that will help you simplify your travel healthcare career. Go to bluepipes.com and join today. Finally, you can connect with us on Facebook at facebook.com/bluepipesinc, on Twitter at bluepipesinc, or follow our YouTube channel for more great videos. And as always, have a safe and productive travel healthcare adventure.